Make yourself comfortable. Okay, I'm Dr. Sarah. Pleased to meet you. Okay, so before we start, just to make sure I have the right notes, can you just confirm your name and date of birth for me? Yep, that's perfect. Thank you. Alright, so what brings you here today? Okay, you've got a few problems with your eyes. What seems to be happening there? Alright, so they're feeling a little bit achy and tired, maybe a bit sore. Okay. Alright, let me just check. You weren't on any medication. You've not changed that at all? No supplements? No, okay. And you're not diabetic, alright, because obviously diabetes can affect your eyes. Okay, I'm just having a little check. Have you changed your job at all? No? How much time do you spend on computers or tablets or mobile phones? Okay, so quite a lot of time, alright. And you don't use any glasses or lenses to correct your vision at present? Okay. Alright. Okay, now do you use your mobile phone, tablets at night in a dark room? Yeah, do you tend to use it right until you fall asleep? Alright, so you're spending a lot of time in front of a screen, albeit small or large. Alright, okay. So describe how your eyes are feeling. Alright, so they're aching quite a lot. Do they ache more when you're trying to watch the screen or trying to write? A little bit of both, alright, okay. Have you noticed any unusual discharge from your eyes, or do they feel unusually dry? Okay, a little bit dry. Itchy? Alright, okay, only a tiny bit. Alright. Does the aching tend to be just in your eye or around your eye? Or do you get headaches? A few little headaches and feeling a little bit sore around your eye. Okay, sort of around that orbital area. Okay, that's fine. Okay, have you noticed any spots in your vision at all? Any flashes of light? Anything unusual with your actual vision? Okay, nothing like that. And no migraine headaches. Okay. Any nausea? Right. And I do have to ask you this. Have you been drinking or smoking recently, or taking any substances at all? Okay, do you drink alcohol? No? Well done. Do you smoke? No, that's good. Not taking anything else. Alright, just have to check. Alright then. Let me just pop that down a second. What I'm going to do first is I'm going to just have a little check around your eye. Just the skin area around your eye, if that's okay. Just to make sure there's no strange things going on with your skin around your eye. It won't hurt. Okay, right. So just keep nice and still for me, and I'm just going to press gently just around the eye area, okay, just underneath, okay, and both sides. How does that feel? Is it a little bit tender? Alright, okay. And just above the eye area on both sides, just underneath, okay. Your skin looks a little bit dry. Okay, I'm just going to just pull your eyes down a little bit. Alright, okay. Just pull them down, okay. Look up for me. Alright. That's okay. Okay, and just pull them up a little bit there. Can you just look down for me? There's a little bit of redness there, but I don't think it's an infection. I think it's possibly more to do with a bit of eye strain. All right. Now, one thing I want to check is your blood pressure, okay? Because that can affect your vision and give you a few little headaches. All right. So, let me just get my equipment together. You've had your blood pressure taken before, haven't you? I'm sure. Okay, so I'm just going to be popping this on your arm, right, and I'll inflate with this, and I'll pop the stethoscope onto your arm at the same time. Alright, so let me just get my stethoscope in position. Okay. That's all good. Alright. And let's do that blood pressure of yours, okay? Just outstretch your right arm for me. Thank you. Let's just get that on. There we go. All right. So, I'm just going to pop the stethoscope into the crease of your arm, okay, and inflate the cuff. I'm sorry it's going to feel tight. Let's just get this nice and set up there. Okay, so just breathe normally and I'll start to inflate the cuff on this right arm. Okay, great. All right. Sorry it's tight. Okay. That all seems normal. Okay, so let's just let the air out of the cuff. So really tight on there. There we go, that's better now. Okay, that's fine. What I'd like to do is just check it on your left side, if that's okay. Alright. Let's get this on this left arm. There we go. Lovely. Just going to pop the stethoscope onto the crease in your arm. Make sure this is all ready to go. Get that on there. Alrighty, here we go again. Okay, gently let the air out. That's good. All good. There we go. I'm happy with that. I'll just make a note of it. It was 125/84, so that's okay. You do exercise? Yeah. Okay, that's good. Right. I just want to take a further look into your eyes with my light here first, okay, just to check your pupillary reaction. Alright, so what I'd like you to do is just look straight at my nose, okay, and I'm going to shine this light in and come from both sides, okay, so just keep looking right at my nose. Perfect. Perfect. what I'm going to do is just occlude one eye. So I'm just going to use this device there and just occlude the eye a little, alright? Okay. And just come across. Just come across there. Okay. And I'm now going to occlude the other eye. There we go. And just come across. Just come across there, just to see how that's looking. That's fine. Okay, can you just look up for me? Okay, and look down for me. Okay, and just follow the wavy line up and down and up and down. Okay, and just across and across. That's perfect. And the wavy line one more time. Okay, that's fine. So your ocular muscles are doing fine now, which is good. Okay, now I'm going to want to look into the back of your eye. Alright, and to do that I want to just put a couple of drops in your eyes just to make the pupils dilate and I can get a better look with my ophthalmoscope. Is that okay? Alright, so let's just find the drops. Okay, you've had eye drops in before? Okay, so we'll start with your right eye. Just look down for me. Okay, and there we go. And let's do the other one. Okay, same again. Okay, just look down for me. Alright. Let's just swipe a little bit off your face because they do tend to just run just a little bit. Okay, now your eyes are going to feel a little bit strange, okay, for a while, and I will reverse it, but it might take a while afterwards. But it's not a sunny day, which is good, because it wouldn't be good on a sunny day to do this, because your pupils don't constrict afterwards for quite a while, although the drops do help it to work quicker, to shrink back, but the daylight is quite bright. Okay. Alright, how's that feeling? Good. Okay, well I'll just give you a couple of minutes to sit there and then I shall come back and have a look at the back of your eye and see if everything's doing well there. Alright? Okay. How are you doing there? Good. I can see those pupils are dilating nicely now. Okay. I just want to check something while they're finishing off. Can you see that letter there? Yep, that's perfect. Okay. Can you still see it? Yep. Okay, can you still see it? Good, okay. Can you see those two letters there? Good. Can you still see them? Can you still see them? Good, and could you just tell me what that colour is there? And what that colour is there? Okay, that's good. Fine. So let's have a close look at those now. That's looking good. Okay, so this is an ophthalmoscope and it allows me to look at the fundus, the back of the eye, to look at the vessels and the optic disc, and just to make sure everything is fine in there, that there's no signs of any eye disease. Okay, I don't suspect there is, but I can check this. Alright, so I just need to turn the light on. You see it just has a little light, and you can see the light there. Okay, and you'll see me turning the wheel. This is just to alter the diopter so I can get a good clear view. Okay, so I'll start with your left eye. Okay, so I'm just going to pop my hand up onto the top of your head, and I'll come in and look into your eye with this. I won't touch you, but I will come in close. Okay. Alright, okay. So let's just look at this. Okay. Alright, so I'm just going to pop my hand up there, and I'm going to come in close now. And just have a look. Alright, okay. Are you okay there? Good. Good. Just going to have a look around. Alright, a little bit closer. I'll just cover my own eye up and move my hand so I can come in a little bit closer. Alright, okay. Let me just have a look at your red eye reflex there. Okay, perfect. That seemed fine. Alright, okay. So I'm going to do the same on your right eye. And I just need to come in close to you again. Okay. And just put that up to my eye and just come in and have a look around. Is that okay for you? Good. Just going to come in a little bit closer. Okay. Everything looks fine. The optic disc looks fine. The arteries look fine. Everything looking good. Okay. And let me just have a little look at that red eye reflex again. Okay. Wonderful. We won't need that anymore. Okay. So, I'll just make a couple of notes. Right, while your pupils are dilated, I just want to have a look in your eyes with another light, okay? But this time I'll be doing some little short, sharp flashes of light, okay? Let's check that's working. So I'll just be doing something like this, alright? Okay, so just look straight at my nose again. Okay, and let me just shine some little flashes of light. Okay, and again, keep nice and still. Just keep looking there for me. Okay, just looking around. Okay, and just look up for me. Thank you. Keep looking up for me. Okay, could you just look to your right? Wonderful. And can you look to the left, please? Thank you. Alright. That's fine, you can relax now. So I'm going to pop some different drops into your eyes now. These are going to reverse the effects of the dilating drops. Okay, so there we go. Let's pull them. Just look down for me a second. Alright, there we go. Lovely. Okay, and the same again this side. Just up and look down for me. Okay, that's good. That's all sorted. So let's give you a little pat on. Alright, I'll give you a couple of minutes for your eyes to clear there. I'll just update this. Okay. So what I'm seeing is your eyes seem a little dry. I think your problem is to do with eye strain. Okay, looking at devices, sometimes not in the best lighting, perhaps spending too much time on the screen. Okay, but I will refer you to an ophthalmologist, okay, just for a full eye check where they can look to see if you need something to correct your vision. I only did a very small check to see if you could see the top letters on the Snellen chart today, but I think you might need to go and just get it checked out properly with a full Snellen chart and colour blindness test, which I'm sure you're absolutely fine with, okay? And they can have a more in-depth look in your eye and check your eye pressure as well. Okay, although I didn't see any signs of glaucoma, but you know, it's worth getting that checked out anyway. But I couldn't see anything to worry about, so I would just suggest for now spending less time on your devices if possible. Okay, trying to keep rooms well lit. Don't have the screen too dark or too bright. Something that feels naturally comfortable for your eyes. Yeah, what I'm going to do, I'm going to give you a prescription for some drops. They're Hypermello's eye drops, just basically artificial tears, okay? And they will just help your eyes feel much more comfortable. Use them 3 or 4 times a day, a drop in both eyes, and you'll notice the difference that irritated, dry feeling will go away. Okay, so I'll just do that for you now. And we'll only need one bottle. You'll only need to use them for a couple of weeks, I think. You can also buy them over the counter, so they may be cheaper doing that, so just check, but I will do you a script, okay? Put the date, and I'll just sign that for you. Wonderful. So this is your prescription. You can use it at our pharmacy here if you like, but ask them the price of it over the counter. It may well be cheaper to buy it over the counter. Okay, and at any time if your eyes do feel dry again, you can also purchase more. But if your eyes are feeling really uncomfortable, then obviously come back to me or go and see the optician. Yeah, but I am going to refer you on to an ophthalmologist now. It might take a few weeks to get your appointment, but we'll see what we can do for you. Okay, so there's your prescription. Okay, and I'll look forward to seeing you soon for your annual checkup, which I just noticed is due. But in the meantime, if you have any more health worries, you know where I am. Okay? Alright, so let's hope everything goes well with the ophthalmologist. It may just be that you might need some corrective glasses or something like that, or lenses if you prefer. Yeah. Alright, well you take care and enjoy the rest of your day. Okay. Bye bye.